Welcome, everyone. Today we're meeting to reflect on some of the efforts our Rotary District and clubs took to help our communities deal with the COVID-19 pandemic, and to hear from the partner organizations in that effort. A little bit of a refresher. In April, as you'll remember, District Rotary Foundation leadership and past District Governor Paul Perez applied for and received a grant from the Rotary Foundation's Disaster Response Fund to be used for the COVID-19 relief. Additionally, they used some district-designated funds and contributions from clubs to create a pot of money to be contributed to 3 organizations that serve our district's communities. We'll hear about how the Disaster Response Fund grant was used in a little while. But first, welcome District Rotary Foundation team leader, Kyle Haugen, to share a few more details about the district-wide contributions that became a district-sponsored grant. Kyle?
Thanks, Ed. As we put together the application for our grant through the Rotary Foundation's Disaster Response Fund, we knew that we wanted those funds to be used by our clubs in the way they wanted to support their communities. But we also wanted to do something as a district on a more regional level. Due to COVID-19, we had a few grants that weren't able to be completed last year, which meant we had leftover district designated funds, or DDF, for the year. If we didn't use the DDF during the year, it would only be available for international projects in the future and not put back to our communities. So we had about $16,000 of district designated funds available and asked clubs throughout the district to join us and make contributions so our impact could be even greater. 17 clubs came forward to contribute over $10,000, so our result was $27,000 to be contributed to 3 regional organizations that, between the 3 of them, support every community in our district. We were very pleased to contribute $9,000 to each of these 3 organizations: Channel 1 Regional Food Bank, the YMCA of the North, formerly the YMCA of the Greater Twin Cities, and Second Harvest Heartland. Now, I'll turn it back to Ed so we can hear more about how those funds were used by each of the partner organizations. Ed?
Thanks, Kyle. We invited representatives from each of the 3 organizations Kyle just mentioned to be with us today. And we would like each to speak for a few moments to talk about what their organization does, the activities that were initiated during COVID-19, and how our $9,000 is being put to use. We'll start with Channel 1 Regional Food Bank. Joining us is the Executive Director, Virginia Merritt. Virginia?
All right, had to unmute myself. Thank you so much for inviting Channel 1 to come speak to your group today. And thank you, of course, for the donation and for everything that the Rotarians do for us right here in Rochester. All 3 clubs have been so supportive over the years, both financially and with their volunteerism. And it's nice to see a few familiar faces today. So, hi. First, Channel 1 is a food bank and a food shelf. And so that's a little bit unique because we are the food banks bring in food from lots of different sources, government commodities, donated food, you name it, we're collecting food, retail rescue, and then food shelves distribute food directly to the people. Our vision at Channel 1 is that every community in our 14-county region is food secure. And our mission is that we strengthen food access and build healthy communities. So Channel 1 provides not only food across the region, but also access to that food and works in partnerships with food shelves to provide support and assistance. We've had a lot of new programs in order to respond to the pandemic. You know, I marked the beginning of Channel 1's pandemic response as that weekend in March. It was a Sunday when we heard that the schools were going to close. And we didn't totally know that weekend what the future was going to look like. And as we began planning, we realized that we needed to provide emergency boxes to all of our partners in order to distribute food safely. So typically at food banks, agency partners go online and they order the food that they want through a website. And so they would order by the case or maybe even by the pallet. But we knew that of all of our partners, we were in the best position to box all the food so that our partners could give those boxes directly to the people that needed it, as opposed to having people shop grocery store style at food shelves, which is what they would usually do. So this was a big undertaking. We were open that weekend for volunteers and immediately got to work. And we're proud to say that we provided enough emergency food boxes for the region throughout those early months. And we're still doing emergency boxes for some food shelves now. As we looked at switching to that emergency box distribution, we realized that financially we were looking at a $200,000 per month deficit to run this model. That's a lot in part due to the increased food costs and the lack of donated food. So remember in March when the grocery stores had nothing on the shelves? That trickles all the way down to the food banks. And then even when we have money to order food, we stand in line behind other major vendors. So for a while there, we weren't sure what food was gonna be here until it arrived on the dock, because a truckload of pasta might be on the way, but if a big box retailer with major contracts said, nope, I need it, it's gonna go to that big box retailer. So we put our faith in the community, and the community stood up for us and helped us to raise the funds to meet the needs. So thank you for being a part of that. Now, when we think about the pandemic, we're in what we consider to be the long haul recovery phase. Most of our partners are still distributing in boxes, and we're still doing extra food drops, but we're out of that initial sort of shocking emergency. We've worked with social workers at Olmsted County to provide food at the main campus for community services, so they can distribute the boxes directly to their clients. That was a huge efficiency for them, and also safety, because it meant that social workers could drive through on campus and pick them up and take them to people, as opposed to having to grocery shop for the food for people who needed it, which is what they usually would have done. We've also done pop-up distributions locally with the city of Rochester and in conjunction with the Rochester Public Schools. Throughout the region, we've added 3 to 4 mobile pantries per week, which is a lot because we're used to doing mobile pantries 3 weekends a month. And that is because if you look at the capacity across the region, Channel 1 is the only food shelf in our 14 counties that has enough refrigerator storage to consistently store enough of the fresh food. And that's especially true with the farmers to family food boxes that you might have heard of. So the federal government has provided food boxes of wonderful perishable food, but food banks have to handle that last mile distribution. So getting the food from the food bank to the people, and food shelves don't have the capacity to store those boxes. So it has to go, we say, truck to trunk, from our truck to their trunk. So it's wonderful food, but it's been a big hurdle. So your funds also help go toward that real cost of distributing the food. What do we expect to see in the future? Well, we worked with our friends at Second Harvest Heartland and all of the Minnesota food banks and the McKinsey Group on basically a needs assessment study to see what we expected the demand to be throughout the pandemic, because none of us has ever experienced anything like this, so it's just hard to know what to expect. And what we've learned is by October, we expect to see record numbers of food insecure people. Overall, food banks and food shelves expect to see a 65% increase in demand. Why October and not immediately? Well, the $600 a week in extra unemployment benefits was huge, and that basically prevented a disaster for us as far as a just overwhelming number of people to serve. And with our friends actually at Second Harvest Heartland, we have a phone call to talk to our wonderful senators from Minnesota tomorrow morning to talk about how important the federal stimulus package is and how that's going to impact us, because we need a robust food delivery system with SNAP and government commodities in order to really meet the need. Food shelves and food banks can't do it alone. So I want to thank you all so much for recognizing the need, for being a part of that robust community response that made us able to meet those projected budget deficits, and transport food throughout the region. We couldn't do it without folks like you. And we have some volunteer activities going on, but we're missing our Rotary Repack group. So I can't wait until we're repacking food again and we can see your smiling faces here at the food bank. So thank you again.
Thank you, Virginia. And Channel One continues to be a vital provider for people throughout the southeastern part of Minnesota, and we appreciate partnering with you as well. We'll now move on to our second partner, the YMCA of the North. Here with us is Major Giving Officer Devan Heinsen. By the way, happy belated birthday, Devan.
Thank you so much. I actually had some balloons back here from my team, and I thought I should maybe move them for the call. Well, thank you so much for having the Y here today. We are incredibly proud of our partnership with the Rotary. So many of our leaders are a part of the Rotary, and we take great pride in how we all work together within the community. So the YMCA of the North, it's just brand new, recently rolled out. So I'd love to share a little bit about our recent rebrand within our name. So we are serving communities from Ely to Rochester to Hudson, all over the region. We're really supporting the communities, the youth, and the families who need us most. And throughout this, we've been having a conversation for about the last 2 years. The greater Twin Cities for some was creating a barrier, and it wasn't necessarily feeling all encompassing for all of the communities that we serve. So we just recently rolled out that we are the YMCA of the North. Our branches continue to have their names as the Ridgedale Y and things like that. Those continue to stay the same, but our association is now the YMCA of the North. So the Y, very well known, very well trusted within so many communities. We are for social responsibility, healthy living, and youth development. So the YMCA of the North is actually the 4th largest Y association in the world, and we have the largest camping system out of all of the Ys. And this is something that we take great pride in, is our camps up in. We have Camp Widgiewagon, Camp Kitchiapi. There's a lot of camps, and I hope that there are many people on this call that have their own wine story as well. Times look a little bit different at the Y right now, but we're continuing to serve the community. So in early March, we were told that we had to close the doors for our fitness centers. This gave us a new opportunity. A lot of people know the Y as a swim and gym, but we're much more. And this allowed us to really continue to share this mission story front and center. So we retrofitted all of our branches, and we're continuing to do this, into community response hubs. So what this meant was we were looking at youth, families, and seniors. How can we best support them during this time of uncertainty and real challenge? So with help from amazing partners like the Rotary and our donors like the Rotary, we were able to, and we are continuing to distribute meals. So each of our locations are distributing between 200 and 350 meals a day within their communities. This happened right away. We wanted to ensure, like the other partners that are on the call today, that food disparity is very real, and families and young people trust the Y, and they knew that they could come to Y for a safe space. As a fundraiser, something I take in great pride of with the Y is that we really look at suburban poverty as well. So we were having families coming forward who had never really experienced this food disparity before, but they knew that they could come to the Y and find a place where they could have a meal and lunches for their kids and be able to provide. Another part of this community response hub is financial assistance and priority childcare to our emergency workers. So we held spots for those that were on the front lines and continue to be on the front lines, serving in hospitals and a variety of other areas. They had first service to our childcare, just ensuring that those different elements within our community could continue to operate. And we understand that you want to have a safe place where your kids can go when you go to work. And for many of that place is the Y. Another part of support for families is when the rioting happened around the cities, a lot of stores and things, of course, were burnt down. So our Ys became collection and distribution centers, and through that we supported over 2,000 families within Minneapolis and St. Paul, supporting with all sorts of items that you would typically buy at the store that they didn't have the opportunity to do so anymore because of the things that were happening within the community. So that was another piece of immediate response that we provided with the ever-changing environments that we're seeing within the community. Another piece that was initiated during COVID, as we continued within COVID-19, was around seniors. So even not in COVID-19 times, social isolation is one of the biggest challenges that our seniors face, and it is extremely connected to health and well-being as well. So our teams gathered together and we made over 140,000 calls to our senior members to check in. Do they have people nearby? Do they have the items that they need? How is their safety? How is their well-being? Connecting them to a variety of things. One of my favorite things that we're continuing to do right now is even a FaceTime training so that they can connect with people. They can connect on Zoom, whatever digital platform that they have. They can connect with someone at the Y who can teach them how to use that so that they're not feeling socially isolated. Another piece that we expanded to is digital. And one piece I really want to focus on, if you have any kiddos at home or grandkids, we launched something called 12 First. So we gathered a number of donors who are really connected to family and their kids, and they helped us create this platform, and it's 12first.org. And what it is 12 5-minute activities that you and your kids can do throughout the day when they get that burst of energy and things like that. And that has been extremely fun for our families to share. We've seen videos of them doing this with their kids and things like that. In terms of how the Rotary and your $9,000 is supporting the Y, we're continuing so many elements of this work. And this gift is helping us continue to do the distribution of meals, holding spots for those families that are on the front line so that their kids have childcare, and allowing us to continue to meet our community digitally however people are able to. So that is how your gift is continuing to help us, and this is helping all across the communities that I know so many of you are involved in. As I said before, from Ely to Hudson, we're also in St. Paul, and all of these different locations. We're providing these services across the state and the region to connect communities to what they really need most for our youth, families, and seniors. I appreciate the time to share with you. We're so grateful for our partnership, and we're so grateful that you believe and trust in us with your resources to share that with us. So thank you.
Thanks, Devan. And under full disclosure, I am a member of the Burnsville YMCA, so haven't been in there in a while, but we'll get back to it. And the YMCA, you're right, is definitely more than a swim and gym, and your efforts during COVID have shown that. Finally, let's hear from the second Harvest Heartland. Please welcome Community Engagement Coordinator, Maddie Archbald. Maddie?
Hi, everyone. So excited to be with you today. I'm happy to represent Second Harvest and want to first pass along our immense gratitude for your commitment to our mission of ending hunger together. What we do wouldn't be possible without support from people like you. So thank you so much. First of all, I know Virginia did a great little summary of what a food bank is, but what we do specifically is we collect food from various sources, like Virginia mentioned. This can be, in some cases, big name retailers like Cub, Lunds & Byerly's, Trader Joe's, our local grocery partners, to local farmers all over the state. And then we distribute it to our nearly 1,000 food shelf and meal program partners in our service area, which for us covers 41 counties in Minnesota and 18 in Western Wisconsin. So we are one of the largest and most innovative hunger relief organizations in the US. Last year, we distributed more than 113 million pounds of food. That translates to about 97 million meals to our various hunger fighting partners in our service area, in turn serving over 500,000 of our hungry neighbors last year alone. And then 2020 came along, and it was the year that truly none of us were expecting. This year has introduced unique challenges to us at Second Harvest, just as it's done for every inhabitant of our planet. When COVID-19 made its presence known in the US, we saw the incredible impact it had on our community members, and our teams got to work right away. So right away in March, we initiated an initiative called Minnesota Central Kitchen. And what that is a collaboration between local restaurants, caterers, and hunger relief organizations that brings furloughed culinary teams back to work to make to-go meals using donated food. So as of this week, this initiative alone has served 610,000 meals. These meals are prepared in numerous kitchen spaces throughout the Twin Cities and then are served at more than 50 partner sites, some of those being local YMCAs. So I'm glad that we're coming full circle with all these presentations. We're really all working together to make sure our neighbors are being fed during this challenging time. Beyond the work happening with Minnesota Central Kitchen, our teams have been very busy with other emergency response efforts. Since March 16th, we have distributed nearly 47 million pounds of food, including over 300,000 food boxes. Engagement with SNAP is on the rise as well. SNAP is the Supplemental Nutrition Assistance Program, more commonly known as food stamps. We've seen a 91% growth in referrals, as well as a 72% increase in completed applications from the same time last year. And with no agreement on a congressional aid package to extend benefits, many people are scrambling for resources like SNAP to care for their families during this time. So most households who received the extra $600 per week were actually over income for SNAP at the time and may now qualify since those benefits have run out. So as always, our SNAP outreach team is ready to assist participants with paperwork to facilitate their continued enrollment in that program. Lastly, in efforts to quickly and safely get food to families, we, just as Virginia and the Channel One employees are doing as well, we started holding emergency grocery pop-ups throughout our service area. And these have been a great way to get food to communities who may not have open grocery stores in their area, or they may be so far from their grocery store that if it comes to the decision of having to fill up their gas tank or go get groceries, they don't have to make that decision anymore. So we've done over 140 of those pop-ups since March, distributing a total of 4.1 million pounds of fresh produce, protein, and dairy, lots of essential items that are hard for families in need to come by. All of that to say, the number of people feeling the effects of food insecurity has increased dramatically this year. Tough times related to COVID-19 have left families out of work and facing hunger, and the number of Minnesotans experiencing hunger insecurity is now 1 in 8. That is a staggering difference from our nation's pre-COVID hunger levels and will require food banks all over the nation to meet a demand unlike anything we've seen since the Great Depression. There is so much that we can't control right now, but what we can control is how we show up for one another and handle this crisis as a community. That 1 in 8 statistic can be a bit shocking to comprehend, and what we like to say at Second Harvest is that if 1 in 8 Minnesotans are in need, there are 7 in 8 of us who can help. And we have plenty of food here in the Heartland. We just need the resources to source, store, and distribute it. So we will continue to fight hunger by supporting our food shelf partners, by growing Minnesota Central Kitchen, by confronting inequities in food access, and also by educating the community so they know where to find help and so that they feel okay asking for it. All of these efforts just wouldn't be possible without support from generous neighbors like you all. We are so grateful for the Rotary's partnership and for your incredible donation of $9,000. With that level of giving, we will be able to provide 27,000 meals to our neighbors. Every single dollar donated means a little less desperation during these truly difficult days. So what you've all done is provided a great big serving of hope to our hungry neighbors. And for that, we cannot thank you enough. So I so appreciate your time today and really appreciate the impact that you've made on hunger in our communities.
Thank you, Maddie, and thank you for your efforts and the efforts of your partner organizations throughout the Twin Cities and Western Wisconsin. You've had a significant impact bringing dignity to the lives of people around us. And that's only been amplified through COVID, and I can see we have more work ahead of us. Our district-sponsored grant wasn't the only part of our COVID-related efforts. Here to tell us more is District Grants team leader, Margie Horning. Margie?
I guess it helps if you unmute yourself. Thanks, Ed, and a special thanks to all three of their partner organizations that we partnered with. It's just unbelievable stories, so thank you for sharing that with us. But as Ed and Kyle mentioned, our district also applied for a grant from the Rotary Foundation Disaster Response Fund, and we were awarded $25,000. We felt that the best way for us to use those funds were to allow the clubs to fill COVID-related needs in their own communities, since they would have the most information regarding the needs and know what the greatest impact could be. We asked clubs to submit requests ranging from $500 to $2,500 and asked how they would use those funds in their communities. And we wanted to move quickly, with only allowing 12 days from the announcement to the deadline for submission. We did not know what our response would be, but as you can imagine, it was overwhelming. 33 of our clubs requested funds totaling nearly $67,000. While the contribution was only $25,000, while contributing more than, they requested 67, but then they also said that they would contribute almost $25,000 of their own money in these proposals. But we had only $25,000 available for that $67,000 request. So the clubs did not get their full requests. But between the disaster response grant funds and the club contributions, the response was well over $50,000 to go back into the individual communities. We'd like to highlight two of the projects that were done by clubs today. I'll turn it back to Ed to introduce our presenters.
First, we'll hear from the Suburban Ramsey Emergency Coalition, which includes the Arden Hills Shoreview, New Brighton Moundsview, and Roseville Rotary Clubs. Here to share what they did and how it impacted their communities is Arden Hills Shoreview Rotarian Kent Peterson. Kent?
Thanks, Ed. And thanks for the flexibility that the District Grants Committee had to recognize a coalition of service clubs to be the recipient of this grant. I'll identify very briefly what the coalition is, and then I'll describe the project. The coalition was formed quickly in March and early April. We are composed of 13 service clubs in our 8 city area. Besides the 3 Rotary clubs, there are 7 Lions clubs, 2 Kiwanis and 1 Optimus. And then we also have the 2 community foundations as a part of our coalition. This coalition has been nimble. It has been able to form a partnership with our county officials. Commissioner Aaron Joe McGuire, a Roseville Rotarian, is one of our key advisors, and we are able to get the information from the county to know exactly where the the assistance is to go. And the Rotary money was early money, and we all know that early money is the best money, because we were able to get that money in by, I think we applied for, it was in April. By early May, we were able to get that money. And while we now are up to past, I think as of today, $78,000 in for our coalition to distribute through grants, that was the early money that made it possible to get some momentum. And I should mention that Jeff Holloman from the New Brighton Club has been key in this, and Maria Karam from the Roseville Club was the primary applicant for the Rotary grant. The Rotary grant, and maybe I should describe that there have been 8 grants from the coalition so far, and we have a 9th that's pending. And I want to put a little plug in for the YMCA because it's the 9th that's pending. The YMCA neighborhood centers is something that the YMCA has pivoted from. Maybe you're thinking about the Y as fitness centers. Well, they're doing a whole lot in the community to meet the emergency needs. And the YMCA neighborhood center in our community is one of the applicants that we're considering giving the next grant to. The grant that the Rotary funds went to was one that was created unexpectedly, and we were able to use our funds for that purpose. At the end of the school year, our school district made the choice to discontinue the school lunch program, school meals program. Our school district doesn't have the numbers to make it, it is the Mounds View School District, doesn't have the numbers to make it automatically eligible for all those funds, and they chose to not continue school meal programs. That while we have an overall average income level of socioeconomic condition higher than average, there are many areas of low income, pockets of poverty. So we worked with the food shelf, the Ralph Reeder Food Shelf, and gave them a grant of $10,000. But food shelves don't traditionally deliver the money, deliver the food, and have conditions to circumstances to transport and deal with the food in an emergency. So we worked also with the community partners with youth, nonprofit corporation in New Brighton, and that the Rotary funds went to the community partners with youth for the delivery of that food from the food bank to those communities of need. These are the trailer mobile home parks. These are the apartments for high need families that we were able to identify thanks to people from the service clubs that knew where the needs should be, thanks to the county commissioners, including Commissioner McGuire, so that we can use the coalition method to serve this greater need. And I'd like to close with the quote that we like to use about the coalition, because we have 15 organizations, none of which could do as much as we've been able to do as a coalition. And it's a Helen Keller quote that alone we can do so little, together we can do so much. And it's truly been used. And maybe I'll find one other example. Besides the grants that we have given, we also do volunteer projects. And a volunteer project we did was to make 200 cloth gowns for the Ramsey County Care Center, which needed cloth gowns because they couldn't buy enough disposable. And we had the numbers of people and spouses and friends who could sew 200 cloth gowns within a few weeks, which we could never do with any one of these organizations alone. So this is the example of how Rotary clubs, other service clubs can do so much in these emergency circumstances that we could not alone. And so thank you for the Rotary funds. The early money were very, very useful money. Thanks.
Thank you, Kent, and congratulations on the great partnership between the several organizations that has been formed. and the wonderful work being done there. We're moving a little bit ahead of time today, so we'll be able to take a couple questions after our next presenter. If you have questions for any of our partner organizations or the clubs, please type them in the chat box and we'll try to get to a couple of them. Now we'll hear from Rice Lake Rotary Club, who also received a grant to help with mental health related issues. Please welcome Rice Lake Rotarian Claire Parrish. Claire?
Thanks. So we, with the fast turnaround, we're aware through a Rotary member who happens to also serve on the board of the Marshfield Clinic Foundation that there was a need for the hospital to purchase additional iPads to provide some connectivity for patients who were in the hospital and with the increased restrictions did not have access to their family and friends. The hospital had iPads already, but they were using them for other services. And with the sanitizing requirements that were in place, there just weren't enough to go around. So they were asking for funds from the community to meet that need. We presented this idea to the club and everyone was on board with it. The board committed to putting forth some of our own funds to match what we got from the grant so that we could make this happen for our community members. This was really important to us because many older adults in our area of Northwest Wisconsin don't have smartphones. As was mentioned, they might not have those skills to use Zoom or FaceTime or anything like that. So we were really excited to be able to purchase these iPads, and staff who work at the hospital were more than willing to walk patients through how to use these programs, which are fairly easy to use once you know how to do it. And it was just so important to be able to keep these patients connected with their families, because not only are you in the hospital dealing with health issues, you're doing it during such unprecedented times. So we were very excited about the possibility of doing this project. So with the funds that we were given, the generous amount from the district, combined with our board funds and a club member who stepped up to kind of fill in the gap, we were able to purchase 4 iPads for patients to use in the hospital. We received a lot of gracious thanks from the foundation. We actually had the woman who coordinates the gift giving in the Rice Lake area come and present to our club. They are really hurting for funds as a foundation during this time, so it was really nice to be able to meet one of their needs. She also passed along, and this was something I didn't think about, but she passed along the huge gratitude from the nurse manager, who was so excited that they were going to have iPads that they could use just for patient communication. So I pass that along to all of you, and thank you so much for letting us be a part of this grant process and make an impact in our communities. Something else that we did too is we just designed a small card that will go with the iPads anytime a patient uses them. It shows that the iPads were provided by funds from Rotary, as well as giving them just a little bit of, well wishes and returning home soon. We decided to do that because the iPads have to be sanitized after every use. So we didn't want anything that was going to stick on the iPad. And we figured something that the patient could take home would be the best way to acknowledge Rotary's contribution. And then cases are on the rise in Barron County, unfortunately, right now. So we've decided to hold off on any kind of in-person photo ops. We were hoping to maybe send a couple Rotarians into the hospital to talk to some patients in person as well. But we are going to put those plans on hold with a spike in cases. And I just want to say thank you again. You know, 4 iPads might not seem like it's that much, but it has made a huge impact for those patients who get to use them, and is something that will be able to be used for a long time, even after the COVID visitor restrictions are lifted. So thank you so much again.
Thank you, Claire. And that's one, excuse me, that's one area that tends to get overlooked oftentimes is the mental health aspect. So good on you guys for taking care of that. The Rice Lake area is lucky to have a group of people so committed to making the community a better place. Everyone here today knows the toll that COVID-19 pandemic has taken in our communities, in our Rotary Clubs, and I hope that these stories have made you proud of the role that Rotarians from throughout our district have taken in supporting our communities. Now, if you weren't keeping track of the numbers, here's the bottom line. The efforts of you and your fellow Rotarians in a very short time frame meant that we activated more than $75,000 to be used in our communities in a time of great need. And this doesn't count what clubs have done on their own over the past few months. As I mentioned, we had some time for questions. I'm not seeing anything coming in. But Craig had made a comment that I'll share. To Maddie, Virginia, and Devan, he says, we really appreciate your continuing focus on providing food to those in need. As Rotarians, we always try to do good in the world. But from time to time, it's really important to see how the organizations we work with have done so well where the needs are most important. Thank you all so much. And not seeing any other questions coming in. I think you guys answered them all and wowed everybody. So I think we'll just move on ahead here and get on to our evening because it looks nice out there.
Ed, George has a question. He's holding his hand up.
Oh, okay.
I am technically incompetent. I'm trying to put a question in here. I don't know how to do it, but is there a way for us to, because it takes time to get funds, but through grants and so forth, and I think there's going to be a long-term need for, because I don't think the economy is going to come back fast enough for us to have people come back to work. And I think we're going to have a large number of people in need. Is there a way for our district to accumulate some funds voluntarily that we'd be able to react more quickly than setting up grants? Was that even practical or doable? Because I would be willing to put money into a fund like that.
That's something we can perhaps talk about and try and figure out a way.
I mean, that's a district decision from you folks, but I think it's worth considering because there's so many, I've been studying the economy for years, and I don't want to get into that at all right now, except that I think that there's going to be a long-term need, and the people at the bottom end of society are going to be abused way more than anybody else. And we have to be in a position to help those, especially those with children. See, there's going to be so many families in trouble as a result of this for a long time.
Yeah, well, as I said, it's something we can certainly look at.
Thank you, Ed.
You bet. Thank you, George.
Mm-hmm. So
here to kind of finish up the evening, and we'll take a look at that. And a good suggestion, George.
Okay.
I was saying the same thing that when, oh, I'm forgetting names here. At any rate, one of the speakers was talking that we're just on the front end of things. Things can be a whole lot worse moving forward. But when speaking about the Rotary Foundation and all we do as Rotarians, you know, we often talk about everything we do, that everything we do leads to positive peace in our backyards and around the world. Positive peace is not just the absence of war and violence, it's the fulfillment of all needs in a society. Your efforts in these initiatives over the past few months have been great examples of how we as Rotarians work to bring positive peace to the lives of the people around us. It's not just your physical efforts, but it's your gifts to the Rotary Foundation that make these funds available to be used as well. Thank you for your past contributions as they've helped us make a great impact in our communities and around the world. The need for our impact isn't decreasing either, as Georgia just pointed out. So please continue to make the Rotary Foundation one of your charities of choice. Thank you for the positive peace you create every day through your actions and giving, especially in these challenging times. Keep up the great work, and I must say I am honored to be in the Rotary family with each of you. Have a good evening.